Our project was the DSM-5 Self-Rated Level 1 Cross-Cutting Symptom Measure identifies high levels of coexistent psychiatric symptomatology in patients referred for insomnia treatment. This project was conducted at Melbourne Sleep Disorder Centre, and I was one of the psychologists working in the clinic. Sleep and psychiatric conditions have complex bidirectional relationships, and it's important for psychologists working in sleep disorder centres to be able to quickly assess comorbid sleep and psychiatric symptomatology. A new tool called the DSM-5 Self-Rated Level 1 Cross-Cutting Symptom Measure was created and developed by the DSM-5 task force and work groups to help clinicians identify psychiatric symptomatology that cuts across diagnostic boundaries. Given the complex links between sleep and psychiatric conditions, the DSM-5 Cross-Cutting Symptom Measure was thought to be a useful tool to implement within a sleep psychology practice. This tool was implemented into the client intake process at Melbourne Sleep Disorder Centre, and this study aimed to assess the feasibility of using this measure within a sleep psychology clinic. A clinical audit of 50 consecutive sleep psychology referrals was conducted to assess for comorbidities in the sample. 82% of our referrals had at least one diagnosed comorbidity. Psychiatric diagnoses were also very common, with 26% of clients having one diagnosed psychiatric comorbidity upon referral. You can see in this figure that psychiatric symptomatology, as assessed by the cross-cutting symptom measure, was also very common. You'll see that sleep problems were the most frequently reported symptom, as would be expected in a sleep psychology service. But depression, anger, anxiety, and somatic symptoms were also very common in this sample. You'll also note that suicidal ideation and substance use was also frequently reported. Our findings mean that the cross-cutting symptom measure is a feasible tool to use within a sleep psychology service to assess for psychiatric symptomatology that cuts across diagnostic boundaries. It's the first published study to use the cross-cutting symptom measure in a sleep psychology population. And consistent with past research, there is a high rate of comorbidities presenting within a sleep psychology service. Although the cross-cutting symptom measure is not diagnostic, it is a useful tool in a sleep psychology setting as it allows for a psychologist to quickly assess comorbid psychiatric symptomatology, and it can be useful for aiding further assessment and also for considerations in treatment planning for the client. Future research will also look to assess the accuracy of this tool within a sleep disorders population. Thank you for watching our video. Please feel free to like and share this paper with your professional networks and on social media. And if you have any further questions about the study, don't hesitate to contact us.